The ultimate goal in fighting the coronavirus is what's called herd immunity. That's when a vast majority of a population, in this case people, become immune to a disease. Now, we have herd immunity to polio and measles and mumps and chickenpox, but is it possible with coronavirus? Well, Ujek reports.
This virus isn't going anywhere until we reach herd immunity by hook or by crook, whether it's by vaccine or by 5 years of suffering. We're stuck with this virus.
The answer to solving the COVID-19 pandemic is herd immunity, which a population can reach through a vaccine or naturally if enough people develop immunity through infection. We don't know how close we are to a vaccine, so how close are we to natural herd immunity? To answer that, we first need to understand whether or not you can get infected with the virus a second time.
It doesn't appear to be a common phenomenon, but there have been a few case reports of people who have gotten it, who have clearly recovered, and have landed back in the hospital with symptoms.
Dr. Amy Edwards, an infectious disease specialist at UH, says the chances are low, but it's still too early to tell.
We think it's a very low percentage, and to be honest, there is some research going into the idea that maybe they didn't catch it again, but maybe the coronavirus went dormant in their body and relapsed in some form or fashion.
Even if it is rare to get infected a second time, that's what we know for the short term. Doctors still aren't sure how long immunity would last. One study found the amount of antibodies in a small group of infected people dropped as much as 96.2% in just a few months.
Trying to figure out whether people are immune is key to understanding whether we can even achieve herd immunity.
Dr. Edwards says recent estimates show we need to reach around 90% of the population to achieve herd immunity without a vaccine, which is a long way off with a very high price.
Current estimates are that somewhere between 2 and 3% of the U.S. population has been removed, right? And we've killed 100,000 people to get there. So if we need 90% to be immune, how are we going to get to 90% safely?
Will Ujek.
It would cost us however many hundreds of thousands of lives to get there, and that's what we're trying to avoid.
3 News.